Hi, Dr. Davis here with a little health nugget on carnivore diet versus a semi-vegetarian diet. So there's a lot of research on vegetarian diets, semi-vegetarian, paleo, vegan, Mediterranean diet. For a lot of years, there's been a lot. There's also a lot of anecdotal evidence for carnivore. Anecdotal meaning people saying, hey, I ate this way and I felt much better. There's some evidence that talks about carnivore diet helping neural problems. But I was asked to look at the difference between the two. I figured I would share with you guys my findings. So, number one, for semi-vegetarian, there's a few really good studies. There's the Blue Zone Research study. It was conducted by a couple of different people, but mostly in collaboration with the NIH. And what they found is that 95% of their diets in these centenarian people who were 100, they ate about 95% plant-based, and they had about 10%, 5 to 10% of that was meat. So they would eat meat, a few times a week, and most of it was plant-based aside from that. So lots of legumes, whole grains, vegetables, nuts, olive oil, things like that. When they would eat meat, it would be 2 or 3 ounces. Another study was the EPIC Oxford study. It's a European investigation looking at cancer and longevity and nutrition. It took 65,000 people, and they found that those eating low meat, but not necessarily vegan, had the lowest risks of ischemic heart disease and obesity, and better nutrition status compared to strict vegans. And then another one was 96,000 Seventh-day Adventists. They did a study in California. They compared vegan, vegetarian, pescatarians, and semi-vegetarians. And they found that the semi-vegetarians, those who ate meat once a week, they had the lowest BMI, diabetes, hypertension compared to regular meat eaters, and those that ate meat even less. So it appears like there's a happy middle ground. And there's one more study, a global burden of disease study. NIH did this, and they identified that like about the same findings, basically 50 grams a week of processed meats or less helped. But moral of the story here is that there's a middle ground. You don't want to necessarily, if you're looking for longevity, you don't want to go the strict vegetarian or vegan route, and you probably don't want to go the carnivore route, even though I am a proponent of the carnivore diet for certain reasons. I think that middle ground of mostly plants, maybe 90% plants, and then 10% meat, apparently seems to be good in the research. But let's look at the carnivore research real quick. Like I said in the very beginning, there's not much of it. Most of it's anecdotal. Anecdotal doesn't mean it's not helpful. It just means that we can't say we have these several 100,000 people and it's a really robust study. So the problem here is that people are saying the carnivore diet is helping my Crohn's disease or my psoriasis or my rheumatoid arthritis, which it very well could be, and I bet you it is. They're saying it's improving their mental clarity, reducing depression, losing weight, reversing metabolic syndrome, all great things, and I want that to happen, but there's no longevity study yet showing that. It's all self-report. So, lots of lacking control for all the environments, the placebo effect, the confirmation bias, they're definitely likely. So what I mean by that is when other people say that it's helping, you want it to help you as well. And so even if it's not quite helping, you're going to think that it is. And that thinking that it is might actually be the thing that's causing you to feel better with your mental state. And when your mental state's better, maybe that's what's causing you to lose weight. And maybe that's what's causing the metabolic syndrome to be reversed. A lot of what ifs there. It's in its early stages of looking at the research. I did try carnivore for about 6 months. I did a bunch of blood work, and it did improve things, but not really to a state where anything needed. I should say before, nothing really needed to be fixed, so I didn't really improve anything. It all stayed within the norms. And then also I've done the vegetarian thing, and everything still stayed in the norms. I didn't feel as good, but that could have just been my training. So more of the story here is, I would say, try to stay in the middle. Maybe don't push into carnivore or vegan, but somewhere right in the middle, mostly plant-based, really just to get the fiber, and then get some meat at least once or twice a week. And I'm trying to take my personal opinion out of it and just give you what the research says. So take that for what it's worth, and I hope that helps. Have a good day.